Imagine a healthcare landscape where millions of Americans could lose their safety net, and hospitals face a daunting rise in unpaid bills. That's the reality looming as Congress passes sweeping changes to Medicaid, a program that has long been a lifeline for millions of low-income Americans. In Montana, these changes could dramatically alter the healthcare landscape, affecting thousands of residents and the hospitals that serve them. When Congress passed and President Donald J. Trump signed the massive budget package, known colloquially as the Big Beautiful Bill, the debate was fierce. Democrats argued that the new provisions would devastate Medicaid, while Republicans countered that it would eliminate waste and secure the program for decades. But here's where it gets controversial. The bill's impact on Medicaid is poised to be the most significant rollback of a major healthcare program in U.S. history. Analysts are poring over the bill's details, particularly its implications for Medicaid's operation and funding. While Medicaid itself won't disappear, it's set to undergo profound transformations, potentially reversing the progress seen in states like Montana, which have enjoyed lower uninsured rates and improved health outcomes. The changes could mirror pre-expansion Medicaid, leading to fewer people qualifying for coverage, increased denials, and a surge in uncompensated care for hospitals and clinics. Drew Altman, president and CEO of KFF, a leading healthcare research organization, emphasized the gravity of the situation. This is the first rollback of our major healthcare programs, and it's the largest rollback ever, Altman stated. The primary driver of this rollback lies in the Republican-led changes aimed at reducing fraud and waste, a claim that has been met with skepticism by many experts. Montana's senior U.S. Senator Steve Daines defended the bill, arguing that it would strengthen Medicaid by putting able-bodied individuals to work and addressing perceived misuse of the program. He suggested that the reforms would make Medicaid more sustainable. However, critics point out that there's little evidence to support widespread fraud in Medicaid. For instance, in 2022, Texas reported over $219 million in Medicaid fraud, while Montana reported just over $566,000, placing it among the lowest in the nation. According to recent data, 97% of Montana's Medicaid enrollees work at least part-time or fit into specific exemptions such as being a full-time student, caretaker, or disabled. The remaining 3% is attributed to natural turnover as individuals enter or leave the program due to job changes. The exact impact on Montana remains unclear, but using national data, officials estimate that around 10,000 residents could lose coverage. This projection only accounts for those directly affected by work requirements and redetermination processes. The real toll may be even higher, considering the potential for wrongful denials and individuals opting out of navigating the new system. Two major changes stand out: the elimination of enhanced subsidies for marketplace plans and the anticipated rise in uncompensated care. Without these subsidies, premiums on healthcare.gov could soar by over 75%, potentially pushing millions back into the ranks of the uninsured. This surge in uninsured individuals could strain hospital resources, particularly in rural areas where margins are already thin. Larry Levitt, Executive Vice President for Public Policy at KFF, echoed Altman's concerns, stating that the changes effectively constitute a partial repeal of the Affordable Care Act, undoing much of its progress in expanding health coverage. Rural hospitals in Montana, which have seen stability thanks to Medicaid, may face significant challenges as they adjust to the new reality. Dr. Aaron Wernham, CEO of the Montana Healthcare Foundation, highlighted the broader implications. Closing services that are available to Medicaid patients means closing services that benefit the entire community, he noted. This sentiment underscores the interconnected nature of healthcare systems and the far-reaching effects of policy changes. Montana Commissioner of Insurance James Brown has already warned residents about impending premium increases, particularly in the marketplace exchange. The loss of COVID-era subsidies could make insurance prohibitively expensive for many, forcing individuals to choose between healthcare and other necessities. Healthcare navigators like Olivia Riuta anticipate a phenomenon she calls sticker shock, where many Montanans will find their insurance costs doubling or tripling. For instance, a silver plan that currently costs nothing for someone earning minimum wage might rise to $63 per month without subsidies. This financial burden could force individuals to either pay more out of pocket or opt for less comprehensive plans, leaving them vulnerable to high medical expenses. The disappearance of subsidies also threatens the stability of the insurance market. With fewer people enrolling in affordable plans, the risk pool could become sicker, driving premiums higher in the long run. This cycle could perpetuate a vicious cycle of rising costs and declining enrollment. The increase in uncompensated care represents another significant challenge. Hospitals and clinics are bracing for a rise in patients unable to pay for their care, which could strain already tight budgets. Rural hospitals, which often operate on slim margins, are particularly at risk. Ed Buttrey, CEO of the Montana Hospital Association, expressed concern about the long-term financial sustainability of these facilities after 2030, when the block grant funding is set to expire. In conclusion, the changes to Medicaid represent a profound shift in the healthcare landscape, with far-reaching consequences for both patients and providers. As the nation watches and debates the merits of these reforms, one thing is clear: the ripple effects will be felt for years to come. How will these changes ultimately impact healthcare access and quality? Only time will tell, but the coming months and years will undoubtedly shape the future of healthcare in Montana and beyond.